Hi, we're talking SI pain today. That's sacroiliac pain coming from your SI joint. Now, it can actually be coming from other areas as well. So as always, I recommend seeing a doctor or a physical therapist if you do have chronic pain in that area. This workout is a general workout that I, as a PT and a Pilates teacher, have used on myself for my own SI pain and with clients. Okay, so you are going to need either a small ball, this is just a small squishy Pilates ball, or just a pillow, and you can grab that and come back. I am going to give you a few tips and tricks for that SI joint. So the first thing I'm going to do is teach you a physical therapy tip that can really help that SI joint, and it's called the shotgun technique. Okay, so I'm going to teach it to you sitting. What you're going to do is sit with your legs about hip distance apart. And if this is very hard for you, then you're going to sit in a chair to do the same thing. Put your hands on the outside of your knees and press your knees out into your hands. And we're going to hold it for about 7 seconds. Okay, so you can see I'm not moving. I'm just giving equal pressure of my knees into my hands and my hands into my knees. And then you're going to rest. We're going to do it again. Okay. This is actually, believe it or not, one of the best things that you can do when you're having SI pain. And rest. We're going to do it one more time. You can do this throughout the day, sitting. You can do it laying down and have someone help you with it. Just any time that you're feeling a little off, this is a nice way to set yourself and relax. Now, last part, take that pillow or ball, put it in between your knees, and now squeeze that 7 seconds. Okay? 6, 5, 4, 3, 2, 1, and rest. That's called the shotgun technique. You press out 3 times, holding each one 7 seconds. You press in 1 time, holding it 7 seconds. And again, you can have someone help you if you want to lay on your back. And I recommend doing that throughout the day when you are having some SI pain, and that can help. Okay, so that's tip number 1. And now we're going to get into our workout. So keep that pillow or ball, and I want you to lay down on your back. All right, so you are going to be flat and rested here. Take an inhale. Exhale, squeeze your pillow or your ball. The exhale should last for the squeeze, and then you inhale to release. Exhale, squeeze. And continue here as I chat with you about SI pain. All right, so squeeze takes the full exhale, and then you inhale to relax. And I don't want you squeezing as hard as possible. You're just squeezing about 50% effort. Your glutes shouldn't fire. You should not be tensing anywhere. You should be nice and flat here in your pelvis. So in general, when someone comes to me with SI pain or they're in a flare, I give exercises that's going to help keep that area in neutral. So I recommend when you are having a lot of pain, not doing asymmetrical things like lunges, those kind of things, okay? We want to do things that's going to help keep that pelvis in a neutral position and work the muscles around it. I also don't recommend a lot of really deep stretches unless you've been seen personally and you know the best area to stretch, okay? Stretches can actually really help, but if you're not necessarily stretching the right thing, or if you're already really hypermobile and you're trying to stretch even more, it can bother you. So that's why this workout is going to focus on just kind of helping to keep that whole area really secure to help it heal and feel better. All right, good job. Keep the pillow or the ball where it is. We're going to do a bridge. So what I want you to do is curl your tailbone, roll yourself up 1 vertebrae at a time, just as high as you can go. Pause at the top and curl and roll back down. All right, so we're trying to roll 1 vertebrae at a time. And you'll notice none of these moves I'm going to give you today are necessarily going to be the hardest workout you've ever done. It's not meant to be. This is meant to be from my physical therapist perspective on something you could do every day to help when you're having SI pain, or if you tend to have recurring pain and you're trying to prevent it from happening again. So myself, I have had 2 very bad flares of SI pain, once when I was pregnant and then once in this past year. And this is the routine I add into my life every day during that time to help myself feel better. Okay, so we're rolling and curling up, and then rolling back down. And let's do one more like that. Roll up now. When you get to the top, stay there. Now think about having a flat back, lower down halfway and lift. Half and lift. So it's just these little kind of controlled pulses. 4, because we want to turn on the glutes. We need lots of glute strength. 2, 1, nice. And then curl, curl, curl to roll back down. Nice job. And you can set your pillow or ball to the side. Okay, now what I want you to think about here is keeping that belly button pulled in. Gently keep it pulled into your spine and lift your right leg up to what we call tabletop. And then lower it back down. And then the left leg. And lower it down. Now, if this is difficult for you, you're just going to stay right here. Your goal is to try to keep this area nice and stable. I don't want those hips rocking around all over the place. So what we're doing is we're training the lower abdominals to keep you nice and strong there. All right, so you're either going to stay here, or the next level is bring one leg up, then bring the other one up, and do little toe taps. So I want you to do the one that does not cause you pain. All right, it's important to work within that doable area for yourself, right? This isn't the time to push as hard as you can, okay? This is the time you're trying to let your body calm down and heal. Good, 3 more. 3, 2, 1. Nice job. Hug your knees in. And then you can place your feet back down. Nice job. I want you to go ahead and roll to your side and make your way to all 4s as you listen to this quick video from me. So instead of breaking into your video with a YouTube ad today, I am here to tell you about Built Bar. Now, if you're watching this video, it means you have been in pain recently or you have an injury, and I'm so sorry about that. I want to remind you of the importance of nourishing and fueling yourself. You need good food to heal your body, and sometimes when you're in pain, it can be easy to not eat or to not reach for the most nourishing foods. Built Bar can help you out with upwards of 20 grams of protein per bar. It can help you feel good and get that protein that you need with under 200 calories. Delicious flavors. This is coconut. They also have peanut butter, chocolate, brownie, everything that you can imagine. And my good friends at Built Bar are offering you a discount. Use code VALANT20, that's VALANT 20, to get a discount on your order. Just go to the link below and make sure that you nourish and fuel yourself for your workouts and to feel your best. Okay, so here we are meeting on all 4s. That means your hands underneath your shoulders and your knees are underneath your hips. And I'd like you to take your right leg back behind you, point your toes, lift your leg up and down. Again, what you're being aware of and cautious of here is that you're not letting your body shift all over the place from side to side, and you're not letting your back arch. So when I mentioned at the beginning that we're trying to not do a bunch of asymmetrical work, I meant things that would rotate your pelvis. It's okay to do things like this that are single leg, as long as we're really being aware that it's the leg moving and working. So we're strengthening the glutes and the hamstrings, outer and inner thigh on that nice rested pelvis. Okay, last one, lift it up, stay there, little pulses, 8, 7, 6, 5, 4, 3, 2, 1. Bring it back in. Let's do the other leg. So send the left leg back, toes are pointed, lift, lower. Nice, keep those elbows just slightly bent. and 4, 3, 2, 1. Keep it lifted. 8, 7, 6, 5, 4, 3, 2, 1. Nice job. Bring the leg back down. Go ahead and separate your knees nice and wide and sit yourself back for your deep child's pose here. And then slowly come back up. And let's sit, if you can, in a cross-legged position. And if this isn't a happy place for you, you can sit up in a chair for this one. Arms are going to come out to the side, and we're going to take our left hand down and our right hand up to stretch. We're stretching our side. I'm aiming for that quadratus lumborum here, which tends to get really tight when you have SI pain. And then slowly reach back up and take it the other way. So this is a nice, gentle stretch. We do need to stay mobile, but we're trying to really aim more here at that low back, the side waist that I know, for me at least, gets so tight when my SI joint is bothering me. So, so tight. Nice job. Just one more each side. Back up. Nice job. Arms come down and lay down on your right side. So we're going to have your head in your hand. I would like your hips stacked, your feet together, knees together, and lift just your top knee up and down. So these are called clamshells. We're working again to kind of help stabilize the low back, teach those muscles how to work. And then we're working our outer hip here. Good. 4 more. 3. Almost done. We're in the home stretch. 2. 1. Nice job. Take your time. We're going to go to the other side. Again, I know when you're having pain in that area, just changing positions can be hard, so take your time. Come on down. Stack your hips. Your heels are in line with your tail. Lift the top knee and lower. Good. And 5 more. 4, 3, 2, 1. Nice job. Lay on your back. And if you have that pillow or ball close, I'd like you to use it one more time between your knees. Okay. Rest your feet because we need to settle that pelvis one more time. So take an inhale. Exhale, gentle squeeze on the ball. Inhale, relax. Exhale, one more squeeze. Good. Now just keep the ball. So just squeeze it enough to keep it there. On an exhale, curl your tailbone. This is going to be our last bridge. Roll yourself up one vertebrae at a time. Inhale at the top. Exhale, curl, roll yourself back down. Nice job. Hug your knees into your chest. And great job. And I truly hope you feel better soon. Thanks so much for stopping by. Remember, subscribe to my channel and you'll be notified every time a new video comes up. Like and comment on this video and let me know what you thought. You can also always come over to jessicavalantpilates.com to find all the resources I have for living a healthy lifestyle, including full-length workout videos, healthy recipes, and a community I would love for you to be a part of. So I'll see you there.